So we're going to get started here with a long-anticipated panel discussion on building relationships and resilience, public health approaches to violence prevention. And for me, the development of this panel has been a long time coming. I was inspired to really be thinking about this issue not only from what we see, unfortunately, on the news every day, we hear about from people that we know and experience that our society is suffering from diseases of despair. So when there's a loss of hope, not seeing a way out, issues of aggression, addiction, suicide, and violence of all forms increase. And we are really experiencing what I would call an epidemic of violence. And so just as all of us here think very much about the upstream factors that drive health and well-being, thinking about an epidemic of violence and what is happening to our society that we have reached this crisis, there's the issue of looking at regulations of weapons, but it's really the humans and our communities and what is happening with these individuals that need to be addressed. And so I'm honored to have been able to assemble this outstanding group of very special panelists and to have Steve Wolf, one of our Institute scholars, to moderate the panel. So I'm going to turn it over to Steve. For those of you that may not know Steve, he is one of our Institute scholars. He is also Distinguished Chair of Population Health and Health Equity at Virginia Commonwealth University in Richmond, where he does a lot of work with the communities in East Richmond. And he's former chair and founder of the Center for Health and Society. And also, for those of you that may be aware, the IOM report on shorter lives and poorer health, Steve was the co-chair for that report, which really shook the foundation of the conversations about what's really driving health outcomes. So with that, welcome Steve and our panel.
The report that Diane mentioned looked at the health of Americans compared with people in 16 other high-income countries and found large differences between our health statistics and those other countries. And not surprisingly, one of them was deaths due to violence. Certainly gun-related deaths. There's no comparison between the mortality rates we have in the United States and other countries. I think this is really a topic that is so appropriate for us to talk about at the Institute because it's not only the importance of upstream issues, but it really does require integration across sectors to come up with an effective solution, and I think our speakers will probably be addressing that. I have my cheat sheet here that Diane provided for me to help with the introductions, and I was studying it last night in the hotel room with the local news on, and they talked about a shooting that happened, I think, just a couple of days ago. Yeah, and I mean, all of us, we have this on our local news every night, and it's a major public health scourge. But let me get on with introductions because we want to hear from our panelists. So our first speaker is going to be Linda Deguitis, and we had a chance to talk a little bit at lunch. She's the Chief Science Officer for the Avielle Foundation, which I hope you'll be hearing more about in her comments. Previously to that, she was at the CDC, where she was director of the National Center for Injury Prevention and Control, so she knows of what she speaks. Before joining CDC, she was on the faculty at Yale, in a professor of emergency medicine and public health, and also an associate clinical professor of nursing at Yale. And way back, Robert Wood Johnson Health Policy Fellow in Senator Paul Wellstone's office. So without further ado, Linda.
You can steal the chair there. Okay, thanks. I'm not using slides. I'm just gonna talk, so be a little bit different. But I'm gonna start out with a couple of stories. My background and experience with respect to violence has been fairly extensive, in that, in addition to doing work at CDC and overseeing what was being done there as far as violence was concerned, I have a clinical background in nursing and worked in trauma and critical care and took care of a lot of people and families, patients and families who were victims of violence. And this was in both Chicago and in New Haven. So there were areas where they were pretty much inner city kinds of places. We saw a lot of gang violence in some of them. We saw suicide. We saw all kinds of things. And so that's one piece of where I've been coming from on this, and I can tell you about some specific cases. But the day that we had a 14-year-old come in and who was shot in the abdomen and didn't live with his parents anymore or anything, and had a fairly significant injury, needed a colostomy. I saw him in clinic about a month or so later, and he had actually left the hospital without signing out. He just took off, and the police then found him and had him in the youth detention facility, and they brought him in. He didn't want to have his colostomy closed or anything, which is kind of unusual for a 14-year-old, but he didn't want to be back in the hospital. And that was the kind of thing we saw on a regular basis in the emergency room and in the trauma case. We also saw people who died by suicide. We saw we even had people who were having some of their fights, their beefs out in the street, come into the operating room with guns trying to finish off what had already happened. They had shot somebody, we were trying to resuscitate the person, and they come in with their guns at 2 or 3 in the morning and try to finish off the whole thing. So that was part of my experience clinically. I had a nephew who died by suicide, who hanged himself after he didn't get admitted to law school where he wanted to go. And then, I've had a cousin who unintentionally shot himself with a gun he was cleaning. And, we've seen a lot of things recently where, last week a friend of mine emailed me and said, I need your help. She's at the University of Utah, Salt Lake City, one of their medical residents who had come there. She finished medical school in June. She came from San Francisco with her boyfriend. They were living together. Everything seemed fine. And last week, the boyfriend killed her and then killed himself. And nobody's quite sure exactly what happened, but both sets of parents said they had no idea that there was any problem in the relationship. But, this is a young woman who had a lot of promise and future, and she was actually the second person who had died at the University of Utah within the past 3 or 4 months. There was an undergraduate who was killed in the fall. So my friend said, I need your help. I need to know what to do. What can we do? How can we make something different, or how can we change this here? And a little bit further back, on December 14th of 2012, I was at a meeting at a conference center in Atlanta and came out to make a phone call, and CNN was on the news, and there was the reports of the shootings at Sandy Hook where 26 people were killed by Adam Landsman. I immediately left and went back to my office knowing that we would start to get calls about this, but that we couldn't do anything, that we were not allowed to even say anything, that we were not allowed to talk to the press about gun injuries, gun violence. We were not allowed to do anything but give them data on background. And the data that we had were at least 2 years old, because the CDC and HHS had not done anything to keep up with the data. And in fact, now you can get data from 2017 if you want it, but you can't get 2018 data. So that hasn't improved very much. But anyway, we had a lot of inquiries, and I spent probably the next 2 months spending about 90% of my time working on the aftermath of this, even though we couldn't say anything, we couldn't talk about it. I had people in my center who would say, don't even say the word gun in the center, because we shouldn't talk about guns at all, okay? We had the executive orders from President Obama to resume research on gun violence and to do some work in the area. That was not done. There was money that could have been used, but we had to use the excuse on the outside that there wasn't money to do it. We did have violence prevention money that could have been directed towards it. But the director at the time did not want to do that. So we had a lot of things that could have happened that didn't happen. And this is the public health agency for the country. 5,000. If in some year we had, or even in a week, we had a bunch of people die of an infectious disease, in a minute there would be a lot of money committed to it, and there would be a lot going towards it. You might remember Ebola. How much money went into doing something about Ebola when how many cases did we take care of here in the U.S.? Very few. But there was a big initiative and a huge effort to do something about it. This, every time something gets reported, it's like, oh, well, we have thoughts and prayers. That really does a lot of good, doesn't it? Yeah. Or, well, now that those young people took action in Parkland, things are going to change. Has anything changed with them? Have you seen anything change? And we ignore, we look at the mass shootings, we ignore what happens on a day-to-day basis, and I know you guys are going to talk about that, so I'm not going to take away your stories from that, but I think you're going to have some really interesting and informative stuff to tell us about that. But we don't even talk about the day-to-day shootings. We don't talk about suicide. We don't talk about the fact that, that people die from suicide or die by suicide. And what we do is we tend to report it as somebody commits suicide, not that they die by suicide, that it might be the end stage of a disease process. And in that way, we frame it so that there's a bias against the person who dies by suicide. So there's a lot of things that we don't do that we can do. So in public health, we talk a lot about data. And usually that's one of the first things that we try to do is to figure out what's going on and to collect the data and see what the risks are and what the protective factors are and maybe develop some interventions that can be used. We've been working to do that for a long time, but clearly we're not being successful at it. And there's probably a lot of reasons we're not being successful at it. One is that funding is a big issue. We don't have the money going to research on violence that we do having to go to other things. And it's not just gun violence, it's all kinds of violence. It's intimate partner violence, it's child maltreatment, it's the broad range of things and the broad range of types of violence. So we don't have the money going to that because we don't see it as important as a society, or we don't see it as a public health issue. We see it as something that's a criminal justice issue or something that somebody else can take care of. And the criminal justice system has not solved the problem of violence, clearly, because we're seeing more and more violence. It's not the criminal justice system alone that does it. It's so many other factors. It has to do with education. It has to do with housing. And these are all public health pieces of things. Poverty, economics, frustration that people feel because they can't make it. It's not about just arresting somebody and putting them in jail. But the benefit to arresting somebody and putting them in jail is that the jails make money. The prisons are it's basically a private entity. Or a private system, I guess, and they make money. It's a big business. So they're invested in maintaining some opportunities to bring people into prisons. So that's another place that we have opportunities to intervene. And I don't know how many of you have ever been inside a prison. I grew up in Chicago, so we went to Cook County Jail, which was quite an experience walking through there, and even seeing their holding cell for somebody with mental illness. It's not a great place. It's not an environment where people get better. It's not an environment where people recover or learn how not to be violent, or learn how to do other things. It's generally not that kind of environment. In fact, in most prisons, only about 80% of the people there have some sort of substance use problem or difficulty. Only about 12% get treatment for it while they're in prison or in the criminal justice system. So again, we're not doing anything to make those changes. So we have a long way to go on that. So, you know, public health, this is why we're interested in it. I mean, people are dying, people have long-term disabilities, families are affected, children. When children are exposed to violence at a young age, we know from a lot of work that's been done from the adverse childhood experiences studies, you know, the ACE studies, where we look at whether children have been exposed to violence and what sorts of things they've been exposed to. The higher their ACE score is, the more likely they are to be violent as adults and to have problems as adults. So we can do something about that. You know, when children are exposed to intimate partner violence in the home, they're more likely to see that as the normal part of a relationship and to do the same thing or accept it when they're in a relationship. So we know that those are things that we can do something about, and we do know that some things work. I think some of the difficulties that we have, besides the funding, is that people have emotional reactions to violence and emotional reactions to what should be done. I mean, I understand families reacting to what's happened to a family member, a community reacting to what's gone on in their community, but the emotional reactions tend to be on the part of legislators or people who are making policy, where they come up with something that, oh, this is how we can solve it. You know, this is how we can take care of it. You know, it has nothing to do with science. And right now, we all know science has a pretty negative connotation. You know, so they believe something will work, so they want to do it. That's one of our big challenges. The other challenge that we have, I think, is that, and we were talking about this a little bit, is that what we haven't done is we haven't linked the stories of what happens to the data. In other words, you know, somebody gets up and says, you know, 50,000 people have been killed, or 44,000 people died by suicide last year. And nobody can picture what that really means. But if you can tell somebody a story about someone who looks like them or looks like someone they care about, you can have a bigger impact than telling them about 44,000 people dying, because they can then kind of get it. You know, they can say, wow, that could be my relative. That could be my kid. That could be someone I know and care about. And so we have to do a much better job at getting people to tie the stories to the data. And we did that. One of the things I did at CDC was to make the scientists learn how to tell stories, which you can imagine that was really a challenge. I used to make them start staff meetings. I'd just call on one of them and go, okay, now you tell a story about what happened this weekend, and I want it in 2 minutes or less. It was pretty interesting. Yeah, you had to limit it because otherwise, you know, it could go on for the whole hour. You know, we'd never have the meeting. Well, that might have been beneficial as well, but in some cases. So you know, so we have to kind of work together though to get those things to happen, to get the examples out there to illustrate the data. And we found that in the policy area. I worked in the Senate for a while. And if somebody could tell a story that illustrated the data, it was much more powerful than somebody getting up there and saying, well, this is the confidence interval, and here's the p-values, and, you know, the regression analysis shows this. What legislator understands any of that? Okay? I mean, they don't. You know, they don't understand statistical significance. They might understand significant others, but they don't understand statistical significance. So telling the stories is really important, and I think that's a place that we can go. I think the other thing is learning the different languages that we all have. So, you know, every discipline has its own language, every culture has its own language and its own way of talking about things. And it's really important to be able to talk to somebody in the same language that they're using, whether it's, you know, just their colloquialisms, whether it's talking the language of the street, whether it's, you know, talking in a way that they can understand and you can understand them and you can relate to each other. And it's hard to learn those languages. But, you know, even in the clinical, in the healthcare setting, I mean, sometimes physicians talk different languages than nurses, or, like there's this concept of nursing diagnosis, which don't get me started on, but it's crazy because a nursing diagnosis for pneumonia might be alteration in respiratory status or something. Like, what does that mean? You have pneumonia, you take care of it. So I think we need to learn the languages and learn one another's languages and learn how to talk to one another. And I think we also, the other thing that challenges us a lot when we talk about violence is when people get together to discuss it and there's multiple opinions in violence, multiple ways of talking about it, especially when we talk about guns. We have people who say, well, there should be no guns, and then we say there's people who are gun owners and they say we shouldn't take away guns. We need to get away from that. What we need to get to is, given that we have guns around, how do we keep people safe? And can we agree on that? We don't want anybody to die from being shot, whether it's by suicide, whether it's homicide, whether it's unintentional, as a little kid who picks up a gun, So can we get to that and then start talking about what we need to do in order to get there and what can we agree on in order to get there, as opposed to saying, take away all the guns or don't take away any guns, or, because all you do is get into a fight. You really don't do anything else. So those are some of the things that I think I've learned about violence along the way, some of the ideas, and I think we can do something, but I think we all have to do it. I don't think we can say, let's wait for the next person to do it. We have to make it unacceptable as a way of functioning, and we have to make it unacceptable in our communities. And we can't just do thoughts and prayers, and when somebody says thoughts and prayers, I think we need to challenge them on it a little bit and say, well, what is that going to do? How is that going to make a difference? And what are you doing to make a difference? So I appreciate the opportunity to be here and talk about this a little bit, and I look forward to hearing you guys talk about what you've been doing.
Thank you,
Thanks.
Linda. Just a word about the format. We're going to have each of our panelists say their remarks, and as you're listening to them, make a note of your questions, because we're going to have a discussion period afterwards. I know that those comments sparked a number of questions that I have. So Erricka is the founder of Baltimore Ceasefire, and I hope you'll be explaining more about that program. It's a citywide initiative, and I began to learn even more about it last night on the news. She's trained as a mediator and has served as director of training for Community Mediation Maryland since 2005. Her brother was murdered in 2007, and I think that played an important role in the formation of her passion. She has testified in front of the Maryland legislature. She is credited as being one of the forces behind the repeal of the death penalty in Maryland, and I think has been active with the governor's office on crime control and prevention, and has clearly been a major advocate in the community for addressing violence. So, Erricka, we look forward to your comments.
I'm going to be right here if that's okay. Hi, everybody. So if you didn't know, Baltimore Ceasefire Weekend just happened this weekend. It happens every 3 months. And so I'm going to start at explaining to you what the ceasefire movement is, and then I'm going to back up into the story of my life that led to this thing even being birthed. And it speaks to what you've already heard about, that the data is beautiful, but the stories that prove that violence and murder are really public health issues, it's really an epidemic. Those stories are really important. So the Baltimore Ceasefire is every 3 months. We call for 3 days for people to take what we call the Baltimore Peace Challenge. And so this makes it not just about shooting. It really is trying to figure out how can we use collective consciousness differently. So we know that America is a violent place, and in some way, all of us participate in a culture of violence, and we nurture that culture in our thoughts and our behaviors and our behavior on social media nowadays, in the way we act in traffic, whatever it is. And America is designed inside of a violent system of oppression. And so it's designed in such a way that there are some people, a whole bunch of people on the bottom and some people at the top. And anything you do to try to dismantle that system begins to destroy the entire system. And so it behooves the system to make sure that it stays in place in a way where some people are always going to be disenfranchised, always going to be oppressed, always living in criminal conditions, until the people at the top understand that I am because we are. Right? And so as long as they're othering everyone else, right, then they're constantly in fear of losing their way of life and their power with having the privilege of never having to think about how laws and policies and the way they get their wealth and all of that stuff, never having to really think about how it impacts everybody else that they never see. Meanwhile, creating narratives and imagery, right? So for instance, one of my favorite things to point out is how we view black boys in white t-shirts and sagging jeans differently than we view white men in suits and ties, right? So white men in suits and ties have like the best marketing campaign ever in history. Because white men have been killing and destroying ever since the beginning of when they find anything. They'd be like, we should rape it and pillage it and kill everybody and start over and then call it we just settled. We simply colonized. That's all we did. We built a new world, right? And so there's this story that makes it this really beautiful, courageous thing that white men have done forever. Meanwhile, black boys on corners with sagging jeans and white t-shirts are the product of what white men have been doing for centuries. And we are more afraid of the black boys in white t-shirts and jeans. We trust white men in suits and ties, and every day white men in suits and ties kill more people around this planet than black boys in white t-shirts and jeans could ever do. And so, I'll take the amen corner, thank you very much. And so Baltimore Ceasefire is an attempt to inject, first of all, a different narrative about what Baltimore is, right? And so anywhere you go in this country, if you say you're from Baltimore, what do people say to you? The Wire, right? It's one of the first things people say to you. If you're a transplant from somewhere else and you were coming to Baltimore, what were some of the things your family said to you before you got here? Right, you're not gonna be safe. Don't go, you're gonna get shot. They think you're just gonna be walking down the street and get killed any random day, right? And so there's this image and picture of Baltimore that we don't value our own lives, that we don't care about life, that we don't love one another. And I grew up in West Baltimore in low-income housing. And that is where I learned about community. That's where I learned about love. That's where I learned about my own greatness and that I was special and that I was expected to go out and be great in the world. And so this picture of Baltimore that we don't care about that is a very intentional, systematic thing that has happened. And so what we attempt to do is say, okay, so because there's this collective consciousness about violence, what if we told people, well, let's all use that and make agreements with one another. Let's have conversations with one another where we're saying, hey, there's this 3 days at least where we're all purposefully being peaceful. For 72 hours, we're thinking about how we act, what we do, what we say on purpose. And in that space, nobody kill anybody, right? And so what that does is even if you say, well, I wasn't planning on killing anybody anyway, then we can say, all right, but are you as peaceful as you could be? And what can you be doing to be more peaceful? And if you think you're one of the most peaceful people in the world, then now turn around and take a look at your life. And can you point out the ways that your life benefits off of a system of violent oppression? And so now, are your hands clean? And what can you be doing to help the world, just Baltimore, just be a different place, right? And so in us believing in our own power, believing in one another, believing that our lives actually matter, and that if we say that out loud to one another, that what we're going to find is others going, you're right, my life does matter. Somebody should be out here trying to tell me that we shouldn't kill one another. We should keep our neighborhoods safe. I'm glad that you're saying that. Yes, I want to celebrate life for 3 days. So that's the second part to the weekend, is that we ask individuals, organizations, whatever, plan life-affirming events within this 3-day span, so that what you experience is all over Baltimore for 3 days. There are all kinds of events that you can attend. People are being fed, people are getting resources, people are dancing together. Leading up to every ceasefire, there are public planning meetings where people come and not just get information, but they get posters and flyers. And so when you see Baltimore ceasefire posters all over the city, that wasn't me putting them everywhere. I know it looks like I'm everywhere, but I swear to you, I'm just one person with, just like 1 3/4 of a head. So I couldn't even do all of that if I wanted to. And so people are saying, I'm going to put this unified imagery all over the city. I'm going to put it in businesses. I'm going to put a poster in my window. I'm going to harass and vandalize the city with posters on, because we don't care if it's illegal, on subways and light posts and everywhere. And so we know that we are combating an imagery of violence about our city. Right? And so to have this imagery of positivity, that nothing in particular happened. There was not one incident that made all of us go, hey, we need to do this thing, except that there are tragic incidents every single day almost that are happening, and we're all impacted by it. And so it started with just one ceasefire weekend, just an idea. This guy named Ogun came to me when I was a leader in the 300 Men March movement, which was also a group of men going into neighborhoods talking to men about violence. Because if you've seen the data, which I'm sure you have, men are more violent than anybody across ethnicity. And so we're failing men in our society, but that's another talk. But this was a group of men talking to men about peace and about, conflict management and all of that kind of thing. And I was a leader in that movement, recruiting men and recruiting women to help with that movement. And in 2015, the 300 Men March movement declared a state of emergency because the murder rate was on target to hit 300 murders that year. And so at this meeting, this guy came up to me, his name is Ogun, and he said, hey, I have this idea about calling a ceasefire. Like, there should just be a day where everybody in the city knows that it's a ceasefire. But I don't know how to do that, and I think, you could be a person that could help me. And the men that I've asked, who I respect as leaders, have either told me it's not worth doing, it's not going to work, or I was dumb for even thinking that it was something I should do. And so, so when men say no, you got to go ask a woman. And so, because I was like, absolutely, that's something we should do, right? Okay, but then in real life, time went by, we played phone tag and meeting tag and whatever else. But in 2017, I have 3 birth children and a stepson, and my birth son was 19 at the time, and we both were working in the mediation field. His job was to go, he was an AmeriCorps member at the time, going into prisons, doing mediations for people before they were coming home. And so mediating between the person living inside and the person outside so that they could resolve conflicts, make plans, all of that kind of stuff. And so he'd had a hard day doing that. I'd had a hard day doing whatever I was doing. And we were driving home together from work. And he said, Ma, did you know we were talking about today, it was on the news that the murder rate in Baltimore is higher than it's ever been. And so I immediately just got mad. Like, how could that possibly be true? Like, people all around this city are doing work to heal this city. How could the murder rate be the worst it's ever been? And so I started fussing about what they should do. But what about those people who say they have connections to the street and the gangs and all that? They should just call a ceasefire. And then I remember 2 years ago, I'd heard an idea about a ceasefire, and I'm busy being mad at they, not remembering that I am they. And so the next day, I woke up realizing that if I'm that mad about it, it's because of my own guilt and my own feelings of hopelessness and helplessness. And so on the ride to work, I started thinking about, well, what if it was 3 days of people not being violent? What if people were just celebrating life all over the city? And it just was like, right? So in my head, there were like basketball games and cookouts and, stuff happening all over the city. But there was this fear inside me, right, that was like, that is a crazy idea. Like, that's just too big. You're going to be on this mountaintop screaming by yourself, looking crazy. And what if somebody gets killed during the ceasefire time? And it was in that moment that I realized, even if you walk up on somebody, right, to do outreach about this thing and say, hey, there's a ceasefire coming up, let me talk to you about it, and they were on their way to go be violent at the time you had that conversation with them. Now they're going to have a rumbling in their spirit because they've encountered you in this face-to-face, eye-to-eye conversation. And so whatever it is they're about to go do, they can't say nobody ever cared to tell them anything differently. And so I realized it was time for us to have a collective rumbling in our spirits all together, whether somebody got killed that weekend or not. And if they did, it would be an opportunity for us to collectively respond to murder differently. Not just say prayers and thoughts to the family, condolences to the family, but show up and say, we're going to go to the space where the darkness happened. We're going to pour light and love into that space. We're going to not just pray for and talk to one another about what we can do differently, pray for the person who left. We have to talk about the person who pulled the trigger. Right? We have to allow ourselves to think about what it must feel like 10 minutes after you killed somebody. Because until we address what led to that and the aftermath of that and that person, we're not going to heal an epidemic by piling some people in a corner and throwing them in the trash and only caring about other people. Right? And so that's what the movement is all about. And so it's people all over the city. It is people in all walks of life who maybe would have never met each other. And so when I was growing up, being in West Baltimore, I experienced my neighborhood. I knew we lived in poverty compared to white people, right? I was like, okay, we're poor compared to white people. But in my neighborhood, like, you didn't know you were poor as a child. And I got all the love and support and everything else that I needed in that community. And I didn't experience a lot of murder or death or people using drugs or anything like that until I was maybe about 10 or 11 years old. And what I noticed was Nancy Reagan kept telling us to say no to drugs. And I was like, what the hell is she talking about? Well, who? All the grown-ups I knew were going to work every day. All of my friends, we went to school every day. Like, who's using drugs? And so as we kept hearing that, and then the messaging came into the school, right? The more we heard say no to drugs, all of a sudden, guess what? Drugs showed up in my neighborhood. Guess what else? Guns showed up in my neighborhood. And all of a sudden, people were shooting each other over tennis shoes and starter jackets, those NBA jackets with the, right? And that was a phenomenon. But because of the narrative and the conditioning of America, I just thought we were trifling. Right? So what it does to your own self-image when you're the victim of something being purposely sent into your community, you don't know how it got there. People are already living paycheck to paycheck and in despair and whatever it is that they're going through, right? Their public health issues. We now know that your zip code determines your life expectancy more than anything else. And so not knowing that, I just thought we must just be trifling. We need to get it together. I didn't understand that something was happening to us. And so by the time I was 12, I lived in West Baltimore in this low-income inner city place where I'm now starting to experience these different painful, traumatic things, but I go to Roland Park. So this is a different world of kids who can't imagine this kind of thing. And one night I'm asleep, I'm awakened by gunshots, I look out my window, I see my friend Mike. He's banging on somebody's door across the street. Ma, wake up, I got shot. That's not his house. But I guess he figured if she thinks I'm her son, she had a son, right, then maybe she'll open the door. So he's now laying on the ground, ambulances come. I'm watching all of this from my bedroom window. At 12, I don't know what to do because I'm thinking if I try to run out there, I'm going to get in trouble for being outside at 3 o'clock in the morning, right? And so I'm just watching it. And he's laying on the ground. The ambulance comes, and as they're putting him on the stretcher, I hear him saying, God, please don't let me die. Please, God, please don't let me die. So I start yelling out the window, Mike, you gonna be okay? And in my head, I'm like, now I'm weighing the cost of my parents waking up and be like, what are you yelling out of the window in the middle of the night for? You know, but I'm like, okay, this might be worth it if I explain it. But I have to go to school the next day. And all day, this was the first time I felt alone at Roland Park, like really understanding I'm in a different world than these people around me because I'm all day hoping that my friend is okay. And I get home, everybody else already knew he died on his way in the ambulance. I didn't know it until I got home from school the next day. And after that, there seemed to be just a stream. Then I went to Western High School, and it was funeral after funeral after funeral. And until in 2001, one of my brothers got shot, was dead on arrival. He survived, but the conflict that I had with my boss, right, because we don't have compassion for one another when there's violence, somehow we blame the people who are involved in it. My boss went from, oh, condolences to your family, whatever you need, but she didn't understand that what I needed was to use all the vacation and sick time that I never used to now go to the hospital half days to wait for my brother to come out of this medically induced coma that he was in. And she had a problem with it, and she was saying little things, so we had conflict. So she called the Community Mediation Center, who came and did a training for us so that I wouldn't punch her in her throat. This is before I was the peace lady and everything, you know. So, all the West Baltimore deep in me. And so they came and did this workshop, and that's how I found out about mediation work and got involved in that. By 2007, in the middle of I'm now a trainer teaching people in a 6-day training how to be a mediator in the middle of people's conflicts. I get a phone call that my brother is killed, another brother. And so this is the brother who I'd watched my whole life be treated differently from me because he was a black boy, right? So when he was 10, he had an athletic body. He looked like he was about 13. So teachers treated him differently. I came before him, and they viewed me a certain way in my intelligence, and he was very intelligent, but he just process things differently. And I would hear teachers say things to him like, why aren't you like Erricka? Erricka wouldn't have said, Erricka would have gotten it by now, Erricka would have. And as a little girl, I always was angry about that. Like, why would they say things like that to him? And so I didn't understand at the time that all of these things I was experiencing had to do with what America thought about blackness. And it was impacting my experience in my life and in a lot of ways determining the kinds of outcomes I was having in my life at the time. And so as I got older, it became very important to me to really realize I'm not going to fight anybody for my freedom. Freedom belongs to me. Nobody gets to determine what experience I have, how I move through my trauma, any of it. And so we have to have a way of claiming If we want Baltimore to be a certain kind of way, we have to create it. We can't wait. We can keep saying what politicians need to do and what mayors need to do and what whoever needs to do. Meanwhile, their kids aren't dying yet. Because I will guarantee you one thing that when you see me on the news, they'll have to bleep out every other word I say, is when more white kids start dying and suddenly everybody wants to call it an epidemic. And so we have to get moving now, whatever that means. And so that's what this movement is all about. It is about each individual person saying, nothing is too small that I'm going to do to help impact this problem. Any little bit of love that I'm putting into the world matters. And so I started looking at it as this big red ocean. And I'm going to leave you with this. The minute that you start to feel that something you're doing is too small and it doesn't matter, remember that something like the Baltimore Ceasefire movement now gives mothers who've lost their children something to do. They come and get involved in this because they thought there was nothing they could do, but it gives them something to do. And although the murder epidemic is this big, gigantic red ocean and it feels like you're just putting these little blue drops in it, you got to keep putting those blue drops, right? Because if you keep adding the blue, what are you going to eventually get first? Purple, right? So when you start seeing the purple, you're like, oh, wait a minute. Something is happening here, right? And if we keep doing that, right, we get excited about the purple, eventually we're going to see the blue ocean that we want. A day and time exists right now where Baltimore is not as violent as it is right now. That time exists. We are creating it. This is what it looks like. They may not know our names when they're living in a way more peaceful Baltimore, but they're going to look back and go, how in the world did they get from there to now what we get to live in? And so any little thing you're doing matters. And if you don't believe it, just remember that if we all stopped doing whatever little thing we're doing right now, the only thing that would be left is darkness. Thank you.
Thank you, Ericka. That was so inspiring. Again, jot down your questions on your notepad so that we can discuss this further. Our next panelist is Duane Thomas. He is a clinical psychologist and a specialist for, I messed up the laptop, didn't I? For the Sheppard Pratt Health System, and he's an assistant scientist at Johns Hopkins School of Public Health. He collaborates on research projects examining a variety of factors that affect youth and school determinants of health, and I'm going to shortcut the introduction so we can have more time listening. Do you want to stand here? Or,
all over the place. I'm a bit hyperactive, so. And I reached my ceiling at 3, so let's see here. Here we go. In addition to being hyperactive, I'm a bit loquacious, so I figured I would use some slides to keep me in frame and balance and so forth. First of all, let me say that I am immensely inspired. I'm in awe, truly humbled by the work that you're doing and the work that all of you are doing. And if nothing else, one of the takeaways from your presentation in particular is it makes me feel good about the little things that I'm doing to add to this effort. So thank you so much. Thank you so much. Let's give her another hand, please. So I'm here today to talk about the Coping Power in the City project. It's an initiative that's sponsored through the National Institutes of Justice, and it's a partnership between a number of different universities and entities, University of Virginia, Johns Hopkins Bloomberg School of Public Health, Sheppard Pratt, which I'm hired, but also with collaboration with Baltimore City Public Schools. Now, one of the ways that I'm thinking about this presentation now, because listening to you guys just really encouraged me to kind of flip around how I wanted to approach this. But, I think about this work really being a culmination of a lot of experiences that I've had in my life. In fact, when I was listening to Ericka, and when you come from trauma experiences, there could be a number of different issues that kind of trigger that for you. And so listening to her life story, it made me think, back, and I had flashbacks of, actually seeing a person shot for the first time when I was 9 years old on a playground, or having my neighbor murdered outside of my home when I was about 11 years old. I've had countless number of relatives as well as friends to die premature deaths by homicide before the age of 20. And so for me, at a very early age, it began my life work to think about what I could do to affect some type of change, to curb the incidence of violence. And so this work is a culmination of that. Through some of the work that I do as a private practitioner, I have a practice in Catonsville, and I service a number of individuals who were victims of or have family members that were victims of homicide. Quite honestly, some perpetrators of violence, but also my work as a scientist practitioner in universities and so forth. The first panelist has already, I think, set a very important stage in terms of underscoring the fact that violence is a very significant public health issue. And while we understand that it impacts all communities, we also have to appreciate and be very honest and sincere about the fact that it has particularly disproportionately dire consequences for certain communities, particularly African American communities, and particularly African American youth. We understand that there are a host of social contextual risk factors that play a role into that. And again, I think the first panelist did a very great job with that in terms of pointing that out, where we understand that poverty, legacy of discrimination, and racism all play a role. I think the world of public health has done a great job in terms of putting or creating discourse and putting it into our consciousness that the easy accessibility of illegal firearms, of course, explains a huge amount of the variance in terms of the violence that we see play out on the streets. But also we understand that exposure to violence, exposure to community violence is a very important pernicious factor in terms of contributing to the violence that we see play out. We understand that these issues, in and of themselves, they tend to interact in very complex ways, I would say, with some of the general challenges that we see play out in normal development to create risk for individuals for a number of different negative outcomes. Chief among them would be conduct problems in schools, school dropout, a host of emotional, affective issues, all of which can serve as precursors for violent behavior problems. Now, we also understand that these issues in and of themselves are compounded in a city like Baltimore City. I mean, let's be very honest about that. Over the course of the last 40 years, we've seen an uptick in violence within these communities. And perhaps what makes it even more unfortunate is that we have a record number of young people that are going to schools that are directly in communities, are flanked by neighborhoods where violence is taking place, okay, less than a mile from where these schools are located, okay? So out of the 180 or so schools that we currently have within Baltimore City Public School District, about 60% of young people, okay, 60% of young people have had several people within their communities that have been killed by homicide within an eighth of a mile of their school. And unfortunately, when I think about my own experience, being in elementary school, seeing someone shot, seeing someone killed, and so forth, we know that even within elementary schools, young people are not immune to these types of experiences. So it's a very unfortunate set of situations. There's also another reality that I want to talk about here for a bit, and that's the elevated tension between the police department and between the communities or the very people that the police purport to serve. Even before the Freddie Gray situation that took place in 2015, if you were to survey young people, and there were surveys that were conducted, about 80% of young people had a very unfavorable perception of police officers. They talk about situations in which there were situations where they felt, disrespected. They felt it as if they were the targets of overly excessive, aversive, and punitive strategies, and so forth. So there's definitely a situation there that warrants our attention. Georgetown University Law Center recently put out an aggregate of different studies that also talked about the fact that one of the core contributors of why we have these situations that take place with police officers, particularly resource officers in schools, is that they're very upfront and honest about the fact that the vast majority of these officers, there's a paucity of training in terms of how to even engage, how to develop relationships with, and how to work effectively with young people. Many don't even have an appreciation of some of the developmental principles that play out in young people. They don't have an appreciation of learning disabilities and other forms of effective challenges that young people have to face, as well as some of the other social contextual issues that coincide with other issues that make behavior problems a situation that unfolds in schools. So with that in mind, one of the challenges for us as far as this project was to think about, is there a way that we can create or think about some type of a preventive intervention strategy to see what we can do about curbing the incidence of violence within schools, but also how do we think about providing some type of a preventive intervention for high school kids. Now, for those of you who are in the world of research, we know that oftentimes prevention strategies take place at a very early age, which makes a lot of sense, right? How does the saying go? An ounce of prevention is better than what? There we go. All right. We have some prevention specialists in the house here. And so with that, it comes some benefits and some challenges. The benefits is that obviously we want to start early to preempt, right? And to reduce the incidence of these types of problems. But the consequence of that is that while we have a smorgasbord of different types of intervention strategies for young people, elementary school age, burgeoning middle school projects, when it comes to high school, okay, there's a dearth of research sometimes in preventive interventions that would target these individuals, particularly when it comes to violence. And so part of our quest was to think about developing preventive interventions within high schools. How do we also think about dealing with some of the correlates of violence, okay? Dealing with aggressive, disruptive, acting out behaviors within school. How do we also think about internalizing issues that tend to co-occur with some of the externalizing behaviors? But also another important nugget is how do we work in ways to deputize, no pun intended, but how do we work alongside in tandem with school resource officers to involve them in preventive intervention strategies for young people? How do we work in ways to create better interactions and relationships between young people and the police within this work? So that is our challenge. And so some of the goals of the project, one, we wanted to develop as well as to refine. What I'm going to talk about in a bit is the Coping Power project, or the Coping Power model, which is a multi-component comprehensive program that has shown some degree of effectiveness in working with young people, particularly at their early ages. But how can we culturally adapt it and tailor it to high schoolers here in Baltimore? So we wanted to test this model out. But for those of you who carry out research, we know that one of the prime ways that we determine whether something works is to take it through the rigors of randomized control trial, right? So how do we think about carrying out a randomized control trial with ninth graders here in Baltimore? But also, and this is something I would say ambitious, but another way of looking at it hopefully is innovative, is how do we also think about evaluating maybe the broader impact of also incorporating school police officers into this prevention model. And we thought about ways in which we could offer a three-part series to see about enhancing their understanding of adolescent development, but I would also qualify that to say adolescent development within context, because it makes a significant difference in terms of how we understand how adolescence plays out for African American youth growing up in low resource urban communities. How do we also think about ways of helping them, police officers, around crisis intervention, learning how to de-escalate situations to preempt these situations from getting out of control. But I also think that another fundamental necessity is how do we also help school police officers to understand how to identify and how to respond in crisis situations as it relates to mental health related issues when it comes to young people as well. So let me talk a bit about the Coping Power, all right, because I don't know how many people are familiar with the Coping Power project. Coping Power was a project that was established over 20 years ago by John Lockman and Karen Wells out of the University of Alabama. At this present juncture, it is an evidence-based program. It's a tier 2-3, primarily meaning that it's very intensive, as opposed to working with a broad swath of individuals. It's targeted specifically to individuals that are showing some high degree of propensity for acting out aggressive, disruptive behaviors within schools. In addition to providing what we would have as small group sessions for young people, we also wanted to engage them individually as well. For those of you who are familiar with ecological theories and strategies and so forth, we know in order to be effective, it stands to reason to also find ways to engage various systems that's also having an impact on the development of aggressive behavior problems and violence for young people as well. So also within this project, we endeavor to work with teachers as well as parents, providing case consultation with teachers around behavior management strategies, but also working with parents. Because we understand that it means nothing to have any type of impact with young people if we cannot work in ways to help what we're doing to generalize beyond the artificial realm, okay, of intervention places, and help it to generalize and transfer into homes and communities and neighborhoods and so forth. We're specifically targeting the social emotional skills of kids and helping to enhance their repertoire of skills in dealing with situations. And when I mean situations here, we really want to tailor our project to make sure that we are specifically, unapologetically dealing with real life situations that the kids in Baltimore are grappling with on a day-to-day basis. Not flutter around issues, but deal with some of the real circumstances that play out for young people. So prior research has shown that Coping Power has some degree of effectiveness in helping to stem the incidence of aggressive behavior problems, delinquency, as well as helping young people to engage better in classrooms and to prevent early premature dropout. In terms of some of the data from some of the work that served as precursors for the Coping Power in the City project, this is just a line graph that kind of, here I go, boring researcher pointing out some stuff here. But suffice to say that what I'm presenting to you here are teacher ratings of kids' behaviors in the classrooms. And what we see over the course of a year of intervening with the intervention kids versus the treatment kids, as well as a one-year follow-up, we see that over the course of these two time periods, that there has been a reduction in various forms of externalizing behavioral issues in contrast to kids that were going to schools that were part of the control group, around indices of aggression, conduct problems, but also some neurodevelopmental issues as well. Okay, so in terms of attentional issues, learning how to engage better in classrooms, learning different strategies to keep one from being distracted, helping with self-organizational skills, task management, and things of that nature, as well as learning strategies to actually prevent one from acting out impulsively in various situations. This slide here basically just shows a composite of all of these different indices of externalizing issues, and also making the point that over the course of a 2-year span, when teachers are rating the behaviors of the treatment kids versus the control kids, we're seeing that the intervention was having some type of an impact. So the main thrust behind this work is actually some of the various components that goes into the program. So I want to just talk a little bit about that to slow the tempo down a little. So with the student component, which is the main flagship, we're thinking about 16 to 25 sessions working with kids over the course of the 9th grade school year. Working with the kids in small groups of 7 to 10. What we think makes this project innovative is that from the very beginning, we're thinking about sustainability. All too often, and I've been involved in, I've been involved in prevention programs for a while, and one of the main issues that we want to think about is what happens long after the intervention leaves, right? How do we think about sustainability from day one? And so one of the ways that we think about sustainability is how do we work in tandem with someone within the schools to actually co-lead and learn this model, to actually learn how to present the program to carry it out long after the program ends. In addition to the group sessions, we have about 3 to 5 individual check-ins with young people, and we cover a host of different types of behavior strategies. One, how do we understand and identify various forms of emotions and feelings and things of that nature that undergirds, okay, and causes violent forms of behavior. But also, how do we help them to social problem solve? How do we help them to be able to pick apart and to be able to identify various types of aggressive situations? How do we generate different solutions and think about consequences and so forth? But there's also a parent component. We have about 8 to 12 sessions with parents because, again, we want parents to be able to learn these strategies and to learn how to help the young people to also help these situations to generalize beyond schools. Now, I want to move forward here a bit and talk about the police component because I think this is very, very important. So one of the efforts that we have in working with the school police is our main mission is to make sure that they have a keen understanding of some of the warning signs of mental health related issues as it plays out for young people. There's an international program called Youth Mental Health First Aid. How many of you in here are familiar with Youth Mental Health First Aid? I saw one person raise their hand. I saw a person kind of halfway raise their hand and so forth. But it's an initiative, and I'm also certified as a trainer within this. It's an initiative to help people who are not experienced or versed in mental health related issues to be first responders when identifying or encountering someone in a crisis type of a situation. So one, how do we help people to be able to assess when there's a mental health crisis that's unfolding? How do we help them to learn how to listen non-judgmentally? And I would have to say, even as a clinician, as a practitioner, and for those of you in the house that are also practitioners, we know that listening non-judgmentally or having effective listening skills is probably one of the hardest types of skills that any of us can develop. Do I hear amen? Yes. All right. Right. How do we also provide opportunities of giving young people hope? Okay, Erricka talked a lot about how to instill hope in individuals. How do we help police officers by way of their interaction with young people to provide the necessary reassurances and to give them hope of support, of establishing effective relationships? How do we help police officers to know about available resources for young people? How do we get them to direct them to appropriate types, professional types of resources that are available? And also something else that Erricka said that I agree with wholeheartedly. I think as scientists sometimes and as practitioners, I think we're primed to think about deficits a lot, right? All too often, we pathologize, even when we don't think we're pathologizing people. And we think about what's wrong. We think about how do we fix people. We think about risk factors, okay, at the expense of thinking about cultural protective factors, thinking about strengths that already exist within the fabric of the communities that we work in. So how do we also help police officers to understand what those resources are, which I think is critically important. Another important aspect is, and we just had a training around this, Again, getting back to this notion of how do we help police officers understand development within context? And again, the types of development that we're talking about here is how do we help them to be culturally proficient in working with young people? How do we help them to understand some of the racial stressors that young people have to endure on a day-to-day basis? Things that are proximal to them, but also think of the political climate that we live in. Think about the zeitgeist that we live in right now, okay? And how do we provide an opportunity of opening ourselves up to appreciate and allow some type of discourse around some of those issues? And how do we develop within ourselves a sense of racial literacy to deal with some of these onslaughts that young people have to deal with on a day-to-day basis? Not easy. Wrap up? Okay. All right, got you. All right, so we're working with police officers around those endeavors. I will end with this slide here, okay? This slide basically spells out a logic model of the coping power in the city project. I'll make these slides available for everyone, but suffice to say, there are a number of different issues, a number of different variables that we think about to go in to be necessary and critical inputs, as well as different mediators to try to change the perception, not only of young people and parents, but also police officers, leading to outcomes of reducing incidents of violence, and just some lessons learned from this project. One, and hopefully this will be something that informed the work that all of you do. We learned through this project, first and foremost, that flexibility in relationships is something that's critically important. And I don't think that we can talk about this enough. It's critically important for the types of engagement that we hope to have with young people. Not only behavioral types of engagement in terms of how do we create conditions for people to, one, come to the various interventions that we're organizing and providing for them, but how do they get some type of emotional buy-in of what it is that we're doing? Also in terms of flexibility is this. We run into a lot of tension sometimes in terms of the work that we do, in terms of how do we think about this tension between fidelity and being flexible with the work that we do, right? However, within the work that we do, it is important to take a step back and think about, the building of rapport and relationships. And I'll also leave you with this slide here. And this is actually some sentiments that was expressed from one of the police officers that was involved in our project. Anytime we have situations where there's an overabundance of rules at the expense of taking the time to develop relationships with young people, and one, it begins with understanding. It also begins with having some form of self-awareness about your own worldviews, even some of your prejudices and ideals that your own bigotry and things of that nature. I mean, it's critically important. If it's all about rules and not taking the time to build relationships with young people, then it's going to ultimately lead to resistance and the perpetuation of the problems that we have that exist between police officers and the inability of preventionists to actually have an impact. So I just want to thank you guys, and I look forward to the next panelist.
We are running a little bit behind schedule, so I'm going to make this next introduction short. Dante Barksdale is our next speaker. He helped found the Safe Streets Initiative, and this is another example of an attempt at prevention.
Good afternoon, everybody. Oh, man, my knee is hurting. All right, so Safe Streets. Safe Streets is a public health initiative to reduce shootings and homicides. So we are a spinoff of a program called Cure Violence outside of Chicago. Dr. Gary Slucker was an epidemiologist. He was working in Africa, working on cholera. He was looking at how infectious diseases spread, came back to Chicago, put a map over Chicago, said, hey, homicides and shootings is an epidemic. People are dying. We got to do something about it. So he came up with the Cure Violence model. So Safe Streets is the longest running implementation of Cure Violence outside of Chicago. Program started in 2007. We currently have 4 sites: McGalloway Park, Cherry Hill, Park Heights, and Sandtown, Winchester. Now we're going to be expanding this year into 6 new communities. So in Baltimore, kids, it says that the leading cause of death amongst Baltimore City residents ages 15 to 34 is homicide. 30% of our children grow up in poverty, and the youth believe that by the time they're 25, they'll probably just be dead or in prison. And the juvenile homicide rate is 8.4 times higher than the national rate. So we have a major problem. So when we look at this, you see the top 5 reasons for youth dying in Baltimore City. You see homicides and assault sitting right there at number 1. So, stopping epidemics. The curb violence model uses World Health Organization strategies to try to curb the violence. So what we do is we interrupt transmission, prevent future spread, and we try to change group norms. How does that look? Curb violence model stops shootings and homicides. Identifying and detecting shootings, interruption, intervention, risk reduction, and then that behavior change. So how do we do that? The curb violence model. Identify and detection. So what we do is we identify and we detect potential shooting events between individuals, groups, everybody. We're trying to stop a shooting from happening. This is how we get most of our points of entry. Staff knowledge, notice from law enforcement, hospitals, schools, and calls from the community. But most of the time, it's due to the staff knowledge is how we identify and detect the violence, and I'll get into that a little later in the PowerPoint. The street workers, the guys, the people who's working in these communities. If you see these guys, it's a picture of Park Heights. Those 2 guys in the orange shirt and that one guy that says outreach on the back, those guys grew up in Park Heights, lived in Park Heights. They still have addresses right there in Park Heights. They don't never go nowhere. They don't never leave. They stay in Park Heights and fight shootings and homicides. This is what they do. And this is what we need there, because those guys had a rapport with the little guys on the corner, committing robberies, shootings, fightings, and all of that stuff. So the skills that they had to be able to deal with that high risk. They have to be credible. So credibility in the streets is a little different. When you're in the street and you be credible, I could be this robbing fellow. I can go around robbing everybody in the city. But when I go back to my neighborhood, I don't rob. I give out gifts. I look out for people. I do stuff. I was a drug dealer in my neighborhood. It would probably be the same way as an outreach worker. I looked out for people. I wasn't one of the people, somebody messed the money up, I beat them up, drug them down the street, shot them, did stuff. Kind of got some credibility. And they have to be connected to that community and streetwise also. So their primary responsibility is to do what we do. Identify and detect violence, interrupt it, and try to change behaviors and norms. I think I went the wrong way. Okay. So when we hire staff, this is how we hire staff. We identify potential candidates in that community. So most of the time, that's my job. My job is to go into the community, look for guys to do the work. I have a nice rapport with everybody in the city, so I go here and there, trying to find people to do safe streets. But I also take referrals from the community. And if we have an existing site, I'll take referrals from the guys that's at the existing site to try to find out if these guys had the credibility, are they streetwise, are they clean right now, and able to do the work. So what I'll do is I'll do a community walkthrough with them. I'm walking through the community with them. I'm walking with this guy. What I'm trying to find out, do he still sell drugs? Is he robbing people? Do people like him? Most of the time, you find all of this stuff out when I'm doing a community canvas with them, which is like a pre-screen interview kind of thing that I do. I'm walking through the neighborhood, somebody saying to my guy, like, y'all out? Y'all on? He might be still selling drugs, stuff like that. So you're trying to gauge how the community members look at him. Are the little guys on the corner speaking to him as he walking through? Are they saying, hey, what's up? Does he seem to have that kind of respect and that rapport in that community? If he does, what I'm going to do is take him to talk to the rest of the team. Meet the team, invite him to the hiring panel. If he makes the job, we do a 40-hour training with curb violence, and then we have a probationary period for these guys to make sure that they're still not in the life, still doing stuff, or something on their jacket that might not make them credible anymore. So These are the people that we engage. 14 to 25. These guys have to be between the ages of 14 and 25, but we deal with some younger, some older. I'll give you an example. We had a 10-year-old one time, Monument Street, Monument in Bradford, near the OTM store, Young Moose. You probably heard of that little rapper. Makes a lot of noise in this city. He can do a concert on Monument Street, and there will be 10,000 kids down there walking up and down Monument Street. So, the 10-year-old guy is standing in the store. He has a gun really bigger than him. We don't, we looking like, damn, this little kid got a gun on him. So we engage the little guy, we get the gun, we take him in the office, we talking to him. Somehow, some way, Brother Hamza got the gun turned in with the police department. But the fact of the matter is that boy was so little that somebody could have just took that gun from him and probably did something to him. If he would have resisted, he could have got killed, or he could have made a bad decision and shot somebody because he's only 10 years old. So these are the people we engage, 14 to 25 years old, recently released from prison, recently shot, active in a violent street gang, history of violence, weapons carrier, or engaged in high-risk street activity. And that can be breaking in houses, that can be robbing people, selling drugs, doing all kinds of stuff, just high-risk behavior. So the guys have to meet at least 4 of these criteria. But if he's a weapons carrier, we're going to engage him every day. When our guys go out, they're looking for him every single day. So the interruption, intervention, and risk reduction piece. So we intervene in crisis, right? So we help these individuals deal with these stressful moments because he just robbed me, or he just took my money, or he didn't pay me my money, or they shot at me, or he shot at my friend, or whatever. So we mediate the conflicts between the individuals and the groups. We're trying to prevent retaliation. We got 3 ways how we get a mediation. Sometimes we catch it on the front end, sometimes we catch it in the middle, sometimes we catch it at the end. But the point is to try to ward off retaliation. So what we do is we provide ongoing behavior changes for the guys, right? So we try to foster information for them to tell them, like, look, bro, shootings and killings is not normal. You know, if you go shoot that guy, then his man gonna come back and shoot you, and you gonna go shoot, and it's just gonna be repetitious. Violence just perpetuates violence. If you be violent and they be violent, it's gonna get going back and forth. So we gotta come to some kind of consensus. You know, I've even did mediations where I done told the guys, like, well, you know, y'all shot 2 and they shot 2. Them 2 not dead, or them 2 not dead. Right. Can we squash this beef because y'all even? Right. Sounds kind of crazy, but it works. It's real life. Stuff like that goes on. So we're mediating conflicts when people got guns on them. And we don't get guns, we don't get badges, we don't get body armor, or none of that. All I got is, I ain't never tell on nobody. I looked out for a lot of people in the neighborhood. I'm trying to get you some resources, and I'm on the middle road because I got on an orange t-shirt, and it says, Safe Streets. So this is what we do too. We change behaviors and norms, so we inform people about what's going on. We got like this community mobilization thing we do, right? So we organize shooting responses. Whenever somebody gets shot in one of our sites, within 72 hours, we'll do what you call a shooting response. We come out, make a whole bunch of noise. We send emails out, kind of like Erricka do. Everybody come to the joint, get on the bullhorn, and say, shootings and homicides is not normal. What do we want? Safe streets. When do we want it? Now, we just make a whole bunch of noise. Sometimes, it be a little cruddy guy got shot. Now, I'm not saying the cruddy guy don't need love, but the community sometimes don't react to the cruddy guy. So we got to take that in consideration, so we'll be quiet and pass out flyers and just talk to people individually about it, because some people might still like them, some people might hate them, but we don't even want to put that out there. We're just saying shootings and homicides are not normal. So then we sponsor community events. Each site does a community event 1 time a month, or they'll do a participant event. They probably do way more than 1 event because they just do all kinds of stuff. But they're mandatory supposed to do 1 community event. It can look like anything. It could be shake and bake, skating. It could be they got a big cookout. They might be just giving away stuff, basketball tournaments, all of that. In Park Heights, we do one called Battle of the Blocks, right? and it's the bottom of Park Heights. But for us, we look at Park Heights, Cold Spring, back down to Park Circle, we think that's one neighborhood. Whole time, in the street sense, it's about 6, right? And all of them guys are not friends. We got the Hole, we got Candy Stripe, we got Shirley, we got Bowman, and we got Pimlico. And all of it's the same neighborhood, but not to those guys. So they beef about it. So when we created the basketball league, the first time we had the basketball league, the guy said he lost. He said, if this wasn't safe, he started came back and shot all of them. Because he was just mad because he lost the game. So we were just happy that we were safe streets that day. And we was happy that he knew that the guys were there, had great rapport with the neighborhood, and you just probably couldn't even really get away with that because guys was going to be knocking, you know what I mean, doors I done knocked on? When I know little Johnny done shot somebody, I go knock on the door. Man, you know you shot at somebody. You go tell somebody. You tell an aunt, or uncle, or cousin, somebody, because somebody always has somebody to talk to them. Each shooter, no matter how violent they is somebody that can make sense with them. And it might be a peer. It might be a grandmother. It might be an aunt. It could be anybody, but we trying to find that person that can make sense with that guy. So then we also engage faith leaders. We have them come out and we tell them right off the top, please do not come out here talking about Jesus is going to get the killer and send him to prison and all that stuff, because what we know in those streets, sometimes those shooters were victims. A lot of times, them shooters are victims. The victims are victims and the shooters are victims. It goes back and forth. Those guys in that lifestyle shoot each other because they are conformed to what you call the dumb street code. You pull a gun out on me, I'm supposed to shoot you. If you rob me, I'm supposed to shoot you. If you sell drugs on this block and it's not your block, I'm supposed to shoot you. This is the kind of stuff that's going on in the street. They're fighting over street corners. Do you realize you could be on Monument and Milton and you can go 1 block away and it's probably about 100 footsteps, right? Those are 2 different blocks. Those guys don't go down there and those guys don't go down there and the other guys don't come across the street. So these are the kind of problems we're dealing with. So we also educate the public. What we do, we pass out flyers, pass out all kinds of flyers. We got bumper stickers, T-shirts, dog tags, wristbands, anything you can think of to just promote stop shooting. And this is what we do. So in 2018, these are some of the highlights. The Safe Street staff performed 1,382 mediations. Over 80% of them were deemed likely or very likely to end up in a homicide. Now think about that. How did we determine that? That 80% of them was likely to end up in a homicide. Because while I was right there and we was mediating, he had his gun in the car. And they were sitting in the house and they had guns too. So if his gun's on the scene when we're mediating, more than likely, this could have turned into a shooting. So this is what we do. We mediate conflicts. I mean, we've had like one of our guys, then we were mediating a conflict and he got shot by mistake in 2009. It happens. But these guys are committed to our town, committed to Baltimore and trying to reduce shootings and homicide. So during the history of the program, 3 out of 4 of the sites have reached 365 days without a shooting or a homicide. Last year, I think it was October, when our Safe Streets East site had something like 560-something days without a homicide between Patterson Park, Linwood, Monument, south to Baltimore. And that's called down the hill. That's down the hill. People get shot down the hill. You understand? It's kind of crazy over there. People are dealing with a lot of traumatic stuff. We're dealing with a lot of mental health issues, right? We're dealing with street code. We're dealing with poverty. We're dealing with all that stuff, and it's a mixing pot. I tell you like this, right? This is the major thing about that. We could just go through this. Surveyed young men, they were much less likely to support gun violence when they did a survey in our site in 2007 when Daniel Webster did this research right here. The reductions in gun violence occurred in relatively short periods of time after the program implementation. Like I told you, we implemented in, I think it was July 07. I came on, I think like December and volunteered. They hired me in like February. And we went 23 months without a homicide. I was so like traumatized and used to shootings and used to homicides that I used to come to work for them 23 months and just be in awe, like, yo, ain't nobody getting shot, bro. You know what I'm saying? And the craziest thing about it, I don't know why I felt like this. Somebody got shot, and I felt normal again, like. And I was like, all right. And that was crazy. And we had to go do shooting responses and all that stuff. And I was just coming into this kind of work, but it was kind of like, I was like, oh, all right, it's still happening. You know, because at one point we were thinking like, yo, we working ourselves out of a job. We ain't wearing no jobs because ain't nobody getting shot, you know. So we having all kinds of this anxiety, like, man, we gonna lose our job. So when the shooting happened, all of us was kind of like, all right, they still need us, you know, but it's crazy. I mean, it's just how you grow up, the shit you go through. Reductions appeared to spread and spill over to areas bordering Safe Streets Post, meaning like McGalloway Park had Highlandtown and Madison East, and you could see we were affecting those areas even so when we were just in McGalloway Park. So adjusted for multiple factors, including the police intervention. So a study of behavior change published in 2016 found that Safe Streets reduced attitudes towards violence in 15 to 24-year-olds in Park Heights. When they provided with scenarios, youth in that intervention area were more likely to select nonviolent strategies compared to, you know, the controlled community. So what we got to understand is when you put these outreach workers out there, this is their neighborhood. They used to do all of the stuff that people see them do. So the actual reality is that the Safe Streets guys become the example. I know for a fact that Albert Brown, our program manager at Safe Streets Park Heights, doesn't have a GED. He's working on it right now. He could barely write and spell. He's the program manager now. He elevated himself all the way to that. I know for a fact this boy done probably got about 50 people jobs. Literally, like by himself. And I watch him go through the intervention with him. He's not gonna just get you no job. You're gonna go to that Strive program for 3 weeks and get job ready before he send you. Because when we found out, you can't just send people to jobs. You know, people don't, some guys don't even want a job. We don't have to really literally teach some guys how to just build businesses. Because I think if we teach them how to build business, they so used to selling drugs and stealing and doing all that kind of stuff. They're really good businessmen, right? They're really good businessmen, those guys in the street. I mean, they could just, I done seen guys do some amazing stuff, right? They just in the wrong business. And nobody hasn't taught them how to elevate and move to the next level. So this is the kind of stuff I think need to be taught in school. Kids should be 6 to 12. They should be teaching them how to build businesses and do stuff like that. Not just run the hallways and fight each other, because that's all they're doing, because they already know how to do multiplication and division and, you know, whatever. In addition to our full community, Safe Streets Baltimore employs hospital responders. We have hospital responders at Sinai. We're about to have hospital responders at Harbor Hospital. We have hospital responders at Hopkins. Yeah, we have one, and we're about to have 2 more. So the hospital responders, their job is when people come in shot, and then, like, they find out the guy that's, like, it happened in one of our areas, the hospital responder will call the site and say, look, I got little such and such up here. I think he got shot somewhere in your area, right? And then he'll talk to him. They gain the information, come back out, go talk to the interrupter find out what's going on, and then we trying to squash the beef. We trying to ward off retaliation. We trying to do anything we could do from every point to get on top of this violence. So the hospital responders also connect the victims of gun violence at each hospital to support resources, right? And they also get the guys to come back to like follow-up appointments. Hospitals had problems traditionally with gunshot victims coming back for their services, follow-up appointments, stuff like that. What we see in sign now, our 2 hospital responders are able to have guys actually come back to follow-up appointments. They can also have guys, you know how she talked about the guy that was in the hospital where he just snatched the stuff off and left. You see that a lot. I had a participant in Safe Streets East. He had got shot. He was in the hospital for 2 days. He got hit 2 times in the stomach. He's in there for like 2 days. He snatched the stuff off and just came back outside. When I seen him, he was on a dirt bike coming down the street. And then an hour later, they say he collapsed again and had to go back to the hospital. And guess what he did 4 days later? He left back out the hospital again and was wound up killed like a month later. So if we would have had hospital responders at the time, hopefully we could have had somebody talking to him, engaging whether he wanted to leave the hospital or not. You know, giving them information, giving them resources and stuff like that. Because this is what these guys need. So Safe Streets partnered with supporting our students at the Baltimore City Health Department to address risk and productive factors around violence among a high school kid. So we do like a high school curriculum in like these schools right here, Augusta Fells, Frederick Douglass, and Renaissance. We go in there, we teach the kids this conflict mediation training, and to have them be in the school mediating their own conflicts, understanding how a conflict takes place, you know, the stuff that'll make a conflict happen, just everything you could think of just to try to get on top of this violence. And I think we need that in every school. I think that's the last slide. But if anybody got any questions, you can shoot.
Okay, well, needless to say, this I personally found fascinating, and I think it's wonderful, wonderful work that all of you are doing, and maybe we could all just have a round of applause. I have my own questions, but George, you've got the microphone.
Yeah, this is terrific work, and I think everybody here knows how important it is, and we appreciate that you're doing it. Know that we all have to do something as well. I do have a question about something that didn't get discussed, which be interested in your thoughts on the media and the role of the media. Now, it seems to me there are a lot of levels. First of all, there's the level at which they perpetrate the stereotypic racist stories about violence, okay? And Baltimore is a good example of that. But there are other levels in which they contribute to the epidemic. People aren't reading newspapers, so it's no longer, if it bleeds, it leads. But there's the equivalent of that on social media and tweeting and all that stuff, Twitter, et cetera. And I'm wondering if any of your interventions actually engage that production of garbage that's spread around about violence.
I'd like to take that. So that was one of our biggest challenges in the very beginning of the ceasefire movement. So we started with our first public meeting in May of 2017. The ceasefire was going to happen in August. And so there were those people who came to that first meeting to plan how we were going to move forward. That was a big part of it. Like, oh, we should put out a press release, because if the media can be putting on the news that a ceasefire is going to happen, then more people know that this thing is happening. And what we got from every single, from NPR to the local news, it wasn't news, is what they were saying to us. We'll call you on the day after the ceasefire to see how it goes. And so what ended up happening was so many people around the city were putting posters and flyers in everywhere that the news media, on their way to work and whatever, they'd be like, well, what is this ceasefire thing that I keep seeing everywhere? And then they went looking for, well, who is this? But we had designed it in such a way that it wasn't connected to any organization or person. So it took them a minute to find us again. And then it was like it broke the internet before the ceasefire happened. But the ongoing challenge is keeping the media from putting narratives in our mouths about what it is we're doing. And so when somebody gets shot, for instance, if you Google Baltimore ceasefire right now, some of the first stories you're going to see are the ones from the first year. And it's headlines like the ceasefire has ended because somebody got shot, right? And so I've had to spend a lot of time calling them and saying, first of all, you don't get to say that the ceasefire has ended unless you've been involved in this movement. Secondly, the ceasefire doesn't end when somebody gets killed. Our narrative is it pauses for us to show up in the space and to pour light and love into the space and to give the family money and all of the things that we do, but none of the events get canceled. We're still asking everybody to be peaceful for the rest of the weekend. Like, we're still in full motion right now. And so that's taken a while for the media to understand, and even just the dehumanization of how we look at violence. So the first person to get killed during that first ceasefire, his name was Lamontre, and we showed up at the scene. And because we'd already said that if somebody got killed, we were gonna go bless the space, the media was already there and was trying to mic me as I walked up on the scene. And the fire department had just finished cleaning the space so that you could smell the blood and water mixed together right in the spot. And so put aside the fact that I'm a homicide survivor, and so my mom is with me who lost her son, and she's realizing that one of the main reasons why the fire department got there so quickly is because it was a ceasefire weekend, and everybody knew that it was going to be way bigger news now that somebody got killed, and so the space had to be cleaned up quickly because people were going to show up. That's not what happened when my brother got killed. People were calling the police department a week after he got killed, complaining about his blood still in the street. And so, like, put aside all of the triggers of that, just not understanding that regardless of who you think I am in this movement I just started, I'm a human being walking into a murder space. This is probably not the time to mic me and start asking me questions. You know what I mean? And so, me having to navigate how am I working collaboratively with the media and standing firm in what my narrative is, you know, when they're going, oh, don't you think all the murder is because the community doesn't get along with police? And I'm going, so if I blame an epidemic on one thing, I'm putting my reputation and my credibility, and I'm not standing in my own integrity. And so learning how to stand on my own square while they're trying to stuff a narrative in my throat and still have them like me enough that they gonna put me on every chance they get. You know what I mean? Like and in all honesty, that took years before I got involved in this movement of learning how to walk in my own values and integrity so that it didn't matter whether they were cameras on or not, to learn how, and in my own conflict resolution training, right? How to have hard conversations with people so that I'm able to say to the media, here's the narrative, stick with that. If not, you're not welcome to ceasefire events. Right, how to do that in a way where they don't feel attacked and they know that this is a story that is newsworthy. And so now there's this thing where they're looking for positive stories more to tell because they get to tell this particular story every 3 months. He has a mic in his throat.
So anyone in this room who isn't moved by what you guys have been saying isn't breathing.
Facts.
You know, and I love the content of what you're saying. I love your programs, but most of all, I love your passion. And I just wonder how do you see what you're doing to change behavior on the streets, rechanneling passion? Because anger and violence is a kind of passion, and what you're bringing to this change is a kind of passion. How are you working with that to change it? I mean, you're not just giving them programs and you're not telling them how they should behave. You're bringing something you feel really so strongly about.
Love.
How do you do that?
Love. You gotta really just love them little guys, man. Like it's like I don't promise little guys nothing. Like when I'm working with them, I be like, bro, you know, I already know, like you ain't getting no job tomorrow. That's not gonna happen. We can walk in this office. I think it's some noodles in here, some tuna fish in there, some cookies or something, some water, some sodas. Cause it's really about like spending time with them and talking to them. You know what I'm saying? Like we said, people don't listen. Like you sitting there listening and talking. You could pull up a kid randomly off that street, man, And he get to telling you about what he been through in the last 60 days. People be traumatized about this stuff all their life, right? And can't get it together. And this kid still managing to function. You know what I'm saying? So it's really about just loving them and just being around them and just talking to them and just letting them be in your space, because eventually they start figuring it out. You know, because you just, you know, saying little stuff, just giving them advice. Because I don't never talk about, you should do this, you should do that. Because it happened to me. I was working with a little kid, and I said to him, I said, you should go to college. You got your GED. He said, did you go? I was like, no, I ain't go. Right? But then I challenged him, right? Because he helped me. He elevated me to the next level and didn't even realize. I said, all right, both of us going to go enroll in college right now. We're going straight down Sojourner Douglas. He went with me. We both went. I got a master's degree. He didn't, right? But when I say to him, like, boy, you supposed to be going back to school, guess what he tells me? You should thank me because you got your master's. But right now, he a truck driver, so I ain't mad at him.
Right.
He didn't do it the first couple of years, but 4 or 5 years down the line, he went and got a CDL. So, you know, he got his truck driver license, but for the first 5 years, it was just a comeback like, you should be happy that you got yours because I helped you. You know, but that was his comeback. But I wasn't mad. It was still like we helped him get his driver's license through our program, you know, and then he went to driving school at Allstate. He drive trucks. So, you know, I'm good with it. So it's like really, it's just that connection because like with me, I didn't know that so many little dudes knew me. I can just be walking down the street. I don't know half of these little guys' names.
Yeah.
But I swear when I speak to them, you'll think I know them forever. Oh, what's up, my man? What?
Yeah.
You know, compliment them, boy, I like them shoes. Boy, why ain't buy me a pair? You know, stuff like that. You know, just any little thing because I didn't know so many little guys. And I be telling guys like that's really influential in the neighborhood. I be like, bro, you know, you might can say something to this kid, boy, to just turn that light on. You don't even know it. You know what I'm saying? So just try it. You know what I mean? Just try to listen to it. But that's what it is. It's really that passion and that love and just hanging with them because they not getting that. And it's like all of the kids right now, a lot of them, when they go on the corner, drug dealers, charitable as I don't know what, I don't know if y'all know this, but when the drug dealer is standing on the corner, it's conviction for the ice cream truck to pull up. And you don't buy them kids them ice cream. I'm talking about dudes start saying, all right, boy, look, the ice cream truck right here. Yo, how you gonna go buy one ice cream, man? It's like 7 kids right here. So dudes start buying ice creams. When the kids come out the house and say, give me 50 cents, and you give them 50 cents, and they go get a Huggy Juice and potato chip, you just fed them. And you've been doing this for years. So if I'm dysfunctional, and I like to rob people, and I've been feeding him potato chips since he was 6, and he's 13 now, and I say, boy, hold this gun. Put it in your house. I got you. When I need it, just bring it to me. What you think he gonna do? Or she? Because she done built that rapport with him. So we got to give them different role models, different heroes. We need to find a way to get to these kids because they building rapport. It's like the blind leading the blind. All of them just teaching each other how to survive a certain way.
Right, right.
If I'm a robbing motherfucker, my crew is going to be robbers. If I sell drugs, my crew is going to be drug dealers. If we kill, that's what we're going to be doing. And then it's so sad because we got killers walking down the street. They only turn over, what, 30% of these homicides a year? So it's dudes out here that got 2 and 3 homicides walking past me and you right now. So we got to figure this out. We got to figure this thing out.
Look at Diane and see if it was okay. So I just want to say thank y'all. I think all y'all know I work here at the Institute for Integrative Health, but I really appreciate you creating a very clear picture of all of it, right? So I think you all have a very clear perspective on how violence impacts our city, whether it's the need for more research or the importance of relationships or even rewriting our own narratives and saying it from our own mouths. But I wonder if you all can talk about what Erricka was pointing at, which is leaving love and light in places that it's necessary. Like, but what does that look like when you're coming into community that's not your own? Like, how do you really input or lead this thing that's going to be impactful as an outsider. And I say that as a Detroit transplant, but
Yeah,
I think that would be helpful for a lot of people in the room.
yeah. So Baltimore is a place you'll hear a lot of people say real recognize real, right? And that's what Dante was just now talking about. If I'm walking into somebody's, and it doesn't matter if you're from Detroit or from the West Side, because in Baltimore, being a West Side girl going over East, crossing over Orleans, people can tell I'm not from that side of town, right? And initially, I used to be like, I don't know nothing about over East, right? And so I had a nervousness of going into certain neighborhoods. But if I'm coming there to tell people what they should and shouldn't do, oh, y'all need to get off the corner, y'all need to treat your kids better, right? The people can tell you're coming there to judge them. They treat you differently when they know you're coming there to love them. So you have to walk in, and so I view people just like this is my cousin, my brother, my aunt, how would I talk to somebody I love if this is the thing I'm coming to do? So we tell people when they're going, and so this is why within the ceasefire movement, people of all ethnicities and ages can get in groups together and walk into any neighborhood and do Baltimore ceasefire outreach and give out posters and flyers. Because we're saying go into neighborhoods and look people in their eye. Say, this is why I'm coming into your neighborhood. Thank you for letting me be here. We're just coming here to tell you about this thing. But also we're having conversations with each other about what is it that you're going through, because we want to give you any resources you need. Like I'm going to get on my phone right now and Google what you need. You know, like, and so it's treating people like people and not saying because this is a particularly violent neighborhood, we got to walk in all scared and we got to, you know, people can tell if you walk in scared, so that's a judgment on them. People can tell if you're walking in to tell them how to live their lives. And so it doesn't matter where you're from. We're all people. And so, no, I don't recommend. I got we had some of the most gangster white people in the ceasefire movement that I have ever met in my life. Like, just from a standpoint of courage and passion about wanting to heal this city. But they have enough wisdom, right, not to walk into a black neighborhood by themselves. Right? Because no matter how much I know my heart is good, that credibility, how people perceive me in the system that we're in is really important. And so building relationships with one another, where if you're going to go do outreach somewhere, if a murder happened and you want to go bless the space, you should organize that with people who they can walk in there with you, and there is a different visual when I'm coming in there. But when you get there, have conversations with people. Don't just show up in people's neighborhood and start doing stuff, right? Talk to people about what it is you're doing. Invite them to come in and say whatever it is they want to say in the spot. You know, like,
Yeah, input.
and so what I've found is that it was a while, and doing these sacred space rituals particularly, that it even dawned on me that it's still dangerous a lot of times to even go into neighborhoods. Because after a shooting, the retaliation thing is very real. But because I know, I'm also looking at it from a spiritual perspective. And in order to do what I do, there are legions of angels and ancestors that walk with me. And so it didn't even occur to me that I was in danger until one day, I think it was a Safe Streets guy actually that called me and was like, I know you're probably about to go do this space, but you need to know it's dangerous over there. There's a people. And I was like, thanks, I'm probably still going though. You know, like, but it also dawned on me that because we go in with love, the guys that see us burning the sage and doing whatever, they come and start doing it with us. They want to get smudged. They say, oh, that remove negative energy, and they just stand there and hold their arms out, smudge me, do the smoke around me. This is the best. I'm about to cuss. I probably can't cuss, but it's the best thing ever.
Diane, I know we need to wrap up, but can Linda just say a word about the Avielle Foundation? Because I don't think she had a chance to mention
Oh,
it.
I didn't say anything about it. But I also wanted to just add on a little bit to what you're saying, only from the perspective of health practitioners, because I've worked with lots of people in hospitals and clinics who have a severe bias against anybody who's been shot. And you can feel that when they walk in the room. And I think that's another place that we need to address this. You know, having a good relationship with someone, trying to, you know, don't use your personal biases, but that person is there because they have a health problem. They're not there because they're a bad person.
Right.
They're there because they have a health issue. And I think that's one of the challenges we have in sort of the health setting, is looking at, anybody with any kind of, as we would consider, very difficult social determinants of health. We need to do it, but especially with some of the people who have been shot, because I used to see that all the time. I'd see surgeons who didn't want to give them pain meds or something, like he's been shot. I mean,
Why? Because you got yourself in this
well, because you got yourself in this situation, or you were selling drugs, so like, why,
That's violence. Let's be very clear that is violence.
But that's violence. But I think that's something that we need to be aware of, and we need to not think that everybody who's a health practitioner is innocent of any of this, too. And so, and the Avielle Foundation, to sort of change the subject, was founded by the parents of one of the girls who was killed at Sandy Hook in the shootings. And so what we're doing is we're really working on looking at how to build compassion and really change sort of the resilience of a community and encourage brain health and improve the brain health of a community. So we're not looking at things like, we're not saying, oh, we have to look at things like, really focusing on gun policy or something like that. We're really looking at what kinds of things affect the health of somebody's brain, whether it's things like the ACEs, whether it's things that are going on in the community, and how can we work with communities to help them build compassion in the people who are living there, much as you guys are talking about. I mean, just this sharing this love for one another and sharing love for people in the community who are impacted by all kinds of things. But how do we do that, and how do we build an evidence base for it so that the science is there and says, hey, yeah, this works, this changes people's brains, it changes the way that they relate to other people, and it also decreases the violence that occurs. So that's really a lot of what we're looking at. So,
Thank you very much. We are at time, so please join me in thanking our panelists.
We're really so fortunate here in Baltimore to have people like you, Dante, Erricka, Duane, Linda, thank you so much for making the time. Steve for moderating. Dante may or may not remember, we met.
I remember.
About 3 years ago. I was going from University of Maryland Hospital up to Kurt Ann Hospital. This guy picked me up in an Uber. First of all, was the best driver I've ever come across. I mean, and the fastest driver. But then I learned so much in that probably 15-minute drive, the things that you were talking about. And I got to tell you, one thing that went through my head after that drive, and I'd bring it up now, is maybe there's some film producers out there. I thought we could make, and Baltimore could make a different TV series and call it Rewired.
Yeah.
Rewired.
I like that.
That's good.
I like that.
So listen, we're
We're gonna talk about that.
Yeah, that's right. That's why I brought it up.
Rewired. Yeah.
So let's take a very short break. They come back in 3:15. We have Sandro Calleja is here. He's our keynote speaker for this evening, and he's joining us at 3:15 so we can have some discussions around whatever topics you want to bring up then. All right, so just a few minutes. Yeah. Yeah, absolutely. Great. All right, Susan.